Hello guys, welcome to our second chapter, that is outbreaks, epidemics and pandemics. What we are going to do today is in-depth analysis of what is exactly these outbreaks, epidemics and pandemics. The novel coronavirus pandemic is a perfect model for understanding what exactly the pandemic is and how it impact life on a global scale. Since the emergence of COVID-19 in 2020, we start rethinking about the terms which we are going to describe about any diseases. So terms may be outbreaks, or maybe epidemics, or maybe pandemics. Viral outbreaks, epidemics, and pandemics have been an intrinsic part of human history. If you look at Spanish flu, if you look at any other pandemic which was happened in the globe, which was reshaped the societies, our economies, our healthcare systems, and one way it also helped us to improve our healthcare system in a better way. We developed different vaccines and technologies to treat this disease. These events not only have a profound impact on public health but also highlight the need for preparedness, international collaborations, deeper understanding of virus and how they cause the disease. And one more important thing, the countries collaborate each other and develop a new strategies to combat this. This topic explores the definitions, causes, consequences, response to viral outbreaks, epidemics, pandemics, and we are planning to cover most of the topic coming under this particular heading. First topic what we are going to discuss today is viral outbreak or virus outbreak. A viral outbreak or a virus outbreak is a sudden increase in the number of cases of specific infectious disease within a defined geographical area or within a community. This is a give us a chance to locate where exactly the disease starts spreading, the point of origin. So that is the important thing, and it's often exceed what is normally expected within the populations. And outbreaks can be localized and may not necessarily lead to larger epidemic or pandemic. This is the truth about that. It may not lead to epidemic or pandemic, but viral outbreaks are quite common. You might have heard about recently the particularly Nipah viral outbreak, which was happened in Calicut, Kerala, India, where it was a small number of people were infected. There was an index patient. From index patients, then the relatives got infected. From them, a few got infected, and we were able to contain them. So the viral outbreaks are at a small scale or maybe at a community scale. So we can contain them easily with the modern technology and the strategies what we use there. But if it breaks this, if it run out of our control in outbreaks, then it may lead to epidemic. Next concept is epidemic. An epidemic occurs when there is a sudden and widespread outbreak of a particular infectious disease that affect a larger geographic area, multiple communities, even entire country. Just imagine a dengue disease or a dengue infection. Suddenly dengue virus start emerging in Gujarat, Delhi, Tamil Nadu, Kerala, and Karnataka and Maharashtra. Then we can call this as an epidemic, because this virus will be there in mosquitoes or maybe humans. So because of this human to human infection through vector called mosquito, and maybe the favorable condition is helping this vector to breed more, and suddenly the infection start emerging in a different part of a country like India or subcontinent like India, and because of that number of cases increases suddenly. So this is what you call epidemic. Epidemics are quite common in different part of the world. You look at a tropical country like Southeast Asian countries or maybe Latin American countries like Brazil, these epidemic cases are common. So particularly initially there was a Zika viral outbreaks, then it has become a Zika viral epidemic, even Ebola viral outbreak, and later it has become Ebola viral epidemic. But we could control or contain the disease at epidemic level, which did not move to a stages of pandemic. It is characterized by a rapid increase in cases beyond the expected level. So sometimes we calculate uh, from index patient who and all can get the primary contacts or maybe the secondary contacts. We list them, we trace them, we list them, we find out them, and we put them in quarantine mode, and we look for symptoms, and maybe take their samples and test it, and we can get a kind of idea about how the disease is moving from index patient to the primary contact, from primary contact to the secondary contact. But in case of epidemic, is it a little difficult because the number is more, and some of the time it is very difficult to trace the primary contact and secondary contact from index patient if an intact patients traveled more places. If he has taken a treatment at different places, if he has moved to different places in India, then if he spread that disease from one place to another place, there are chances that we cannot contain that disease. So sometimes this epidemic may go beyond the level of expectations. Next is the important topic called pandemic. A pandemic is really a global phenomenon. If we cannot contain a disease at outbreak level, then it move to epidemic level. If we cannot control at the epidemic level, or else we cannot develop a strategy at the epidemic level, there is a possibility that that infection can move to a whole globe, and we call that as a pandemic. The same thing what is happened in COVID-19, which was happened in 2020. And this virus, which has started in China, from there it moves because it's a backpackers. This is what really we call as a backpackers, or the tourists, or the travelers, or maybe business people, those who visit China. From there they have networks throughout the world, so they can carry, they act as a vector. They carry this virus from that particular place into the global populations, and the whole global population got infected at the same time. This is the challenging thing, because in pandemic infection happens at a not in a scaled manner. Instead of that, it happens suddenly in different part of the world, and that time we run short of the medicines, life-saving drugs, or maybe the supportive care devices, or the medical equipments which we require to contain that. So that's why it affects multiple countries, regions, and different ethnic groups. And some population may be immune to that, some population may not be immune to that. Often a high degree of sustained human to human transmission is the main cause for this. Because in case of pandemics, it is just a zoonotic. That means if a disease is from an animal then to human, the less chances. But from human to human, chances are very high, because some of the places it is highly densely populated, and people are moving like anything compared to the last decades. From this decade, the chances of this airborne disease, or maybe zoonotic disease, if it infected human beings, chances of spreading from human to human, from continent to continent, and then throughout the earth is a high chances. So pandemic involves the rapid and sustained transmission of novel virus, or maybe variants. And during this movement, what happened is this virus changes from one body to another body. And during that time, lots of mutation can happen, because its genome is smaller and it got mutated. As it mutates, its symptoms may aggravate. In one person, the symptom may be at a low end, but in another patient, the symptom may be high end based on its immunity and whether he has really compromised for the infection or not. So that's why it's a challenging thing for us to develop a strategies to combat this pandemic. This is the same problem we faced during COVID-19 or in 2020 to contain them. But later we could develop as one thing is the procedure or protocol to manage the disease, and second thing is we could develop a vaccine quickly through a technology, and through which we could contain that. So pandemic is a global problem, even though it affects every society. So we need to have a global collective strategies to manage this. If a one country manages this, and if another country won't manages this problem, then there is a possibility that reinfections, because in case most of the viral cases, people are not developing immunity, because this virus is keep on developing different variants, and those variants are keep on causing high end symptoms compared to the earlier one. So this was the challenging task for a human, when the human population is at around 800 million and people are in a continuous movement. So, what are the real causes of these outbreaks, epidemics, and pandemics? Once we understand what is outbreak, what is epidemic, and what is pandemic, we should know from where, how these outbreaks or epidemics or pandemics are happening. Is it really human is responsible? Whether human act as a reservoir of this virus, or is the wild animal act as a reservoir, or is it the environment acting on the virus and converting this low virulent strain into a high virulent strain? Or is the globalization is responsible, or is it the some population or some ethnical belief state that the vaccine is not so good for their generations, I mean particularly that population? So is it the vaccine hesitancy is the reason? So lots of issues we need to discuss. The first thing maybe coming to our mind is the wild animals. Most of the time these wild mammals, or maybe the other animals, or maybe birds, or maybe pigs, most of these may act as a reservoir, and they may have the antibodies to combat this virus. But through a spillover, that means accidentally this virus can enter our food sources or maybe our water sources, through which it can enter human body. Once it is entered inside the human body, if a load is more, that may cause a problem in that particular individual, or the particular individual, if they are immunologically compromised. That is the challenging thing. If a person is immunologically compromised, he act as he act as a source for multiplication of this virus from that person. That's what you call the index patient. From him, everyone who is in contact with that person will get the disease. So zoonotic transmissions are high. Then one more challenge is the mutation. So because this virus is small, genome is small, skip and mutate. And the globalization is the one more challenge, because people are in a country and travel and move. And the vaccine, some people don't, yeah, I mean, some countries won't entertain to take the vaccine, some won't take the vaccine. So because of that, unless you have a clarity about who and all vaccinated and who and all not vaccinated, it is very difficult to contain these outbreaks or epidemics or pandemics. First thing we need to discuss is the zoonotic transmissions. Zoonotic transmission chances are very high. It's mainly because most of these wild animals act as a reservoir, as I already told, and this virus, either human beings may eat the flesh of that one, or else they may in contact with their urine or maybe feces, or maybe they contact with the other animal which is infected from that particular wild animals. You just look at African bushmeat culture. There they don't cook meat and simply eat that meat. And if you eat meat like that, there is a possibility that if that particular mammal, maybe just imagine a bat acts as a reservoir of particular virus, maybe a COVID-19 virus. And if this virus is there, and if you don't cook that meat, if you can hunt that mammal and eat that mammal without cooking, just putting them in somewhere in the drying in a sunshade and eating them as it is, which can cause this virus to enter our body. Sometimes it won't cause problem if person is immunologically strong, and but person if immunologically compromised, he acts as a source of multiplication. From his body, the virus get multiplied like anything. From him, human to human transmission can happen. That is not only in case of African bushmeat culture, I'm telling, even in many places of the world. So particularly Nipah viral, first when it was observed in Nipah province of Malaysia, what really happened is it was from a bat eaten fruits were eaten by the pigs. From a pigs, it started spreading to the those person who were working in that farms. So this is the idea, that there will be a first source, from that to the second, and where multiplication happens from them to the human beings. And many virus outbreaks starts with the zoonotic transmissions, where a virus originating in animal jumps to animals, that jumps from animal to human beings, and that will waiting for a particular I mean the environmental conditions. So if an environment condition is not suitable for a virus to multiply, it won't transmit. But in some conditions, some maybe a global warming or the temperature change can leads to this kind of phenomenon. This can occur through a direct contact is the one thing with infected animal, or through intermediary like mosquitoes and ticks. This is the one reason. Just imagine ticks are biting a pig. Pig had a virus, a rare virus. From a pig, if that same tick bites human beings, it can carry that virus. So this is the challenging, like HIV, how it spreads from monkey to human beings, like Ebola, like COVID viruses. These are all there in naturally in animals, but from there through human uh, exploitation of animals or hunting animals for a food without cooking them properly and eating, there is a possibility that this virus may spread from these wild animals, particularly the wild animals which act as a reservoir to them, to the global populations. Next important concept is a mutation and adaptation. What this virus does, how this virus acquires this virulency. It is not simple for a virus to acquire virulency in one day. It needs to mutate its gene. And you know the viral genomes are small, it mutates faster more. And just mutation is not sufficient. That mutation should be favorable. That means that it should create a favorable mutation in them so that that virus can make its progeny and adapt over a time. If the mutation leads to death of that virus, that viral disease may get eliminated easily from this globe. But this is not really happening in all the cases. The virus are keep on mutating, and once it mutates, it is attaining a more virulency. And because it is attaining more virulency, it shows high-end symptoms in human beings, and human beings are going to suffer because of that. So this virulency may help this virus to survive better in the environment, and which will make this potent infectious agent compared to other previous virus. I mean the first generation virus. If you look at a first generation virus, maybe a slow spread, low mutated, low infectious. Maybe after one or two mutations, second or third generation virus may be a strong. This may lead to more severe epidemics or pandemics. This is a challenging. Sometimes the mutations, we may make a vaccine for one mutant, but next within a few days, if it mutates again and again and create a new kind of spike protein and other things, which can lead to symptoms and infections. Influenza virus are known for their rapid mutation rates and potential for pandemic strains. So influenza, we know from Spanish flu, how influenza virus is really killing us. And this influenza viral genome is keep on mutating and making this as a global threat. So, and it is all air spread through air or maybe human salival droplets or maybe mucus droplets. So this virus can easily travel from human to human or from animal to human and manage their life cycles. So this virus is a living, non-living entity. Unless it gets a living cell, it cannot survive. So we are keep on providing a host, and as we provide a host, this virus is happily multiply and start causing disease. And one reason for this multiplication is a mutation. From past one decade, if you turn back, the biggest challenge what the humans are facing is the globalization and the travel. One side, the globalization is good for economy. We can buy American product here and we can travel to America. There maybe American person travel here. If you wanted to have a tea from particularly a Chinese variant, you can go there and have and come back. This is the advantage of globalization. But you just look at a human beings, if they keep on move like this across the globe, particularly the tourists, travelers, traveler vloggers, so they can take something from here to there. Just imagine you are taking a particular disease from here to a population in Hawaii, where they are completely isolated from the west other world, and if they get infected, the whole that region of Hawaii may act as a epidemic regions. So this is the challenging thing. Increased global travel has made it easier for infectious agents to spread from place to place or from continent to continent. Just imagine a bat. A bat you can see in a tropical places. So this bat won't move to temperate region. But human beings are not like that. Human beings are temperature resistant. So they can wear a cloth or something and they can travel to any part of the globe. And by taking a medication, we can manage our health better in any unfavorable conditions. But which is not the case in of normal animals. Animals need a favorable condition, then only it migrates. You might have seen the some of our birds are migrating from Siberia to India just for a breeding purpose. So they cannot survive there at a lower temperature, or their egg may won't get fertilized there. But this is not the cases of human beings. Human beings can create through technology. They can we can create a favorable condition for our survival. So in any unfavorable condition also, people keep on migrate. So this globalization is a challenge, travel is a challenge, and next 10 years, maybe the next 10 years, it's going to be more challenging this thing, because people are in a continuous migrations. An outbreak that might have been localized in the past can now become a pandemic due to the rapid movement of people and goods across the borders. Now today, if you grow something in Mangalore, which is not just a Mangalorean product, maybe a global, you can make it as a global product. And if this one carries something and you make it as a global thing, and slowly that disease also will become a global. It doesn't mean that it happens in every day now and then, and globalization or travel may be bad, but the reality is, harsh reality is, the globalization and travel is a very dangerous sign of a viral infections. Because as we move from a place to place, chances that we carry disease also. Education has changed a lot in the globe, particularly the way we think about our approach towards modern medicines. So, vaccine is a possible hope for most of these viral infections. As we all know, there is no antiviral treatment properly working against most of the virus, but there are maybe in isolated cases it may be working, but not in all the cases. So, the only option for us is treat them with our own body. How to educate our body, that is through vaccines. But there is a resistance to vaccination. So this is the challenging thing, because some regions they don't like vaccinations. People don't like vaccination. They kill people who are vaccinating. So it is a difficult task. Can lead to a reduced herd immunity. So the herd immunity means, just imagine a Mangalore. If everyone get immune to dengue virus, then there is no problem of dengue viral infections in Mangalore, because people are immune to it. But to get that immunity, either we have to get infected in a lower dose and then we need to recover from the infection and get the antibodies or the required machineries in our body, or else the vaccinate. The vaccine is the attenuated viral particles, or maybe recombinant vaccines, any kind of vaccines can make our body to get educated about that and create a weaponry which are required to capture these disease causing viruses. So which will, if a person shows a resistance against vaccination, can increase the risk of outbreaks. A disease like measles, mumps, previously it was under control and people were continuously getting vaccinated. But if you look at today, there are cases are reporting. It's mainly because some people won't, they show hesitancy. They hesitancy, because of hesitancy, they don't take the the vaccination, and from there it spread to other parts. So because in case of measles and mumps or maybe polio, so recently there was a news that some cases were reported from Bihar. It's mainly because the people might have taken the polio vaccination. Even after many controlled measure to, education or maybe awareness program, people are not going for vaccinations. If they don't take a vaccination, the only option for a viral disease is the vaccination. So we should stress or emphasize more on a vaccine. So we should get rid of this concept in our brain that vaccine is bad for the body. There is no all hope, so we are going for vaccine, and vaccine resistance can lead to global risk, put people under risk. When you look at outbreaks or maybe pandemic or epidemic, any of this viral infection, it has got a huge consequences. It is drag us backward, both health wise, economy wise, societal setup wise, psychosocial behavior, all those things. There will be a dramatic change in human beings. You look at a pre-COVID human and a post-COVID human, there is a lots of changes. So one, the major changes or consequence we can see in health because of viral infection. This viral infection can bring lots of changes in human body. This can make people hypertensive, this can make people diabetic. So there is a chance that human, those who are normal before the infection, can turn to a potent non-communicable disease born persons, mainly because of these viral infections. Either maybe a viral infection directly or maybe indirectly through a psychological stress what it creates on humans. So viral infections or maybe epidemics that can lead to significant morbidity and mortality in community. That's one more thing. The loved ones are lost in these infections. And these events strain healthcare because of this, it put lots of pressure on the healthcare system. Suddenly many people got infected and you put them in one hospital, whole hospital system under pressure. So overwhelm on a medical facility. So that means overload on a medical facility, so they can't manage it and result in high demand for medical resources and personnel. This is another challenge, because suddenly everyone asking for a vaccine. If our vaccine production capacity is low, it is very difficult to get everyone to be vaccinated. So this is a challenging thing. So the health impact is one side, it infects us and it creates communicable and non-communicable disease in us, and it kill many, our mortality rate. But at the same time, it put pressures on the healthcare system, it put pressures on our production system, it put pressures on our healthcare monetary system. So that is the one thing, because unless we have a sufficient fund to manage the healthcare system, it is the whole healthcare system will collapse. So there will be a shortage of beds, there will be a shortage of life-saving drugs, there will be a shortage of supportive care instruments what we use, or maybe the shortage of ventilators and usage of other medications, all those things. So that means the overall health impact may be there. But at the same time, the developing country like India, if you look at because of COVID, there is a lots of improvement also happened in case of healthcare system. Lots of primary healthcare system which were neglected earlier is upgraded now today, so the people can use it for other treatment purpose. That is a one advantage of this kind of pandemic, this thing, the crisis. I mean, when we look at a crisis, it's a crisis itself. The mortalities happen, that's a sad thing. But the reality is, because of that, we get kind of idea, if something happens in the future, how to tackle it. We'll have a clear work plan, or maybe clear charted, the plan to tackle the disease. So that's why it has a negative impact on the health side, but if you 5%, there is a positive impact on human healthcare system also. Then the second thing, what is highly impacted is economy. So you look at the global economy, which was going down, which was rising like anything, but it went down suddenly. It's mainly because we shut our whole production system, our global supply chain is interrupted. As we interrupt all those things, what really happens is people will lose the job. When people lose a job, there won't be any money to buy, so the purchasing power will go down. As the purchasing power will go down, one thing is there won't be demand for the product. Same time, if a supply chain is broken, there will be a inflated condition where 10 rupees goods may be charged for 200 or 300 rupees, and the persons are jobless, their financial strategy, I mean the condition is low, they cannot afford to buy this kind of goods. So that means the losing a job is a problem. Decline in GDP is another challenging thing, particularly for developing country like India. And the economic recession is a post part of infections or maybe pandemic. Now we are facing it because during that time, whatever thing reserve resources what we had, we used it, and use that money is pumped into markets and made that market live that time. But because of that, what happens, our economy went down, and because of low GDP production, there is a possibility of economic recessions. So when the only possibility is we print more money during economic recession to manage the recession, but in a long run, this will going to harm our economic growth. So that means indirectly the viral outbreaks or maybe epidemics, which will going to kill our economy, one thing, and it will going to stop the tourism. That is a one important economy source for many countries. Some of the countries, if you look at a Bali, a place in Indonesia, which their economy was completely depends on tourism. You look at the post-COVID Bali, where the tourist numbers were less and most of the restaurants were shut down, and most of the other tourism associated business were collapsed, particularly hospitality industries, particularly hotels, hospitality industries, which will collapse. And other sectors are many other sectors which are depends on this tourism and hospitality sector also will get, because they are vulnerable, already vulnerable for economic uh, declines. But at the same time, a sudden pandemic happens and closure of all the economic activities can lead to push this entrepreneurs or maybe this sector completely into a dark mode. Then the one more important thing, which in fact more impacted, particularly in country like India, is the society, the fear and the stigma associated with infections, because the people were not heard about the word called quarantine, social break, crackdown, seal down, all those words. The first time people was hearing about this word and what exactly mean, they don't know what will going to happen if they get infected, whether they will get because of stigma, whether they'll get isolated in a society, and whether they'll get a food or other medications or life-saving drugs to manage their health. So this quarantine measures, travel restrictions, lockdowns can affect daily life, education, and mental health. And stigmatization affected individuals or communities also, because initially people don't know much about a virus, people don't know what about a mortality, people are afraid, because it is something like earlier days how they treated AIDS patients. Same thing was happened in case of COVID, initially in the COVID cases, but later people understood COVID is a disease, it's a disease, but it can be managed well. So then people slowly start come out of that stigma, and now the COVID is a common thing. How we respond to this pandemics or epidemics, and what is the mitigation. So this is the thing. One important thing is the surveillance and the early detection. So these are the crucial to manage these diseases, contain these diseases. Early detection of any outbreaks. If any patient is suspects, we need to test them properly, we need to isolate them. First thing is we need to make that mark that patient as an index patient. From there we need to collect all the data related to primary contact, secondary contact. Then we need to create a strong surveillance system to see that whether these primary contact or secondary contacts are developing symptoms. If any symptom related to that particular cases develop, then we need to test their sample and isolate them further. So through this proper surveillance and early detection, we can contain them, we can manage the disease better. Second thing is a public health measures. Isolation is a one important thing. Isolating a patient. Isolation of a patient doesn't mean that not providing a supportive care. Isolate a patient, but provide them supportive care, food, and all kind of nutritious backup to manage the disease. Same time, the quarantine and sometimes contact tracing. This is the most crucial thing, contact tracings, and the vaccination campaign. So more campaigns are created, more awareness are created, attract more patients, I mean the people towards vaccination centers and give them vaccines and manage the disease well. So the public health measures are important. This is as for the World Health Organization and CDC norms. You see that public health measures are important because we can manage many diseases at the community level instead of spreading to whole state. And these strategies help control the disease at the early stage and spread of the virus and protect vulnerable populations, particularly the children's, elderly populations, pregnant women. So these are all highly vulnerable for disease. So we can protect them. We have a strong surveillance system, strong detection and isolation and quarantine system, and very strong educated vaccination system. So through which we can manage. Just detection and isolation is not sufficient in pandemic cases. We need a very strong international cooperation. We have a World Health Organization which make protocols to manage the disease, but the thing is there should be a public-private partnership, and there should be a resource sharing, there should be information sharing, there should be technology sharing, there should be vaccine sharing. Unless we share them and unless we use them properly throughout the throughout the globe, it is very difficult to manage the disease, because today's India's disease may be a tomorrow's global problem. So the international cooperation is important. And same time, we should not stop research and innovations, because these human beings are prone for diseases. We are keep on facing challenges. So we need to develop new strategies, new vaccines, new varieties of vaccines, not through one traditional classical vaccines. We need to have a recombinant vaccines, first generation vaccines, anyhow we have. But what about a second and third generation potent vaccines? It's not just about the vaccines, a potent vaccines to curb the future pandemic. So research and innovation we cannot stop. We need to fund more for the research and innovations through which we can manage the disease. And that's the third thing is the risk communications. There should be a transparent and timely communication by a government. So government should uh, alert people, create awareness and alert the people about disease. And health authorities help build a trust among inmates, or maybe the patients, and maybe the primary contacts, and encourages compliances with health guidelines, and make a people get rid of the stigma associated with disease, misinformation, conspiracy theories which they develop among surrounding a particular disease through effective communication. So if a government communicate properly with the population or maybe with the people of the country, so it's easy for us to control the disease. Finally, in conclusions, virus outbreaks, epidemics, and pandemics are recurrent challenge for us to test the resilience of societies and healthcare systems. So we need to develop a new strategy. The lessons learned from historic events such as the Spanish flu, or maybe AIDS or SARS or ongoing COVID-19 pandemic emphasize the importance of preparedness, international collaboration, research and developments, new strategies to manage diseases. And as humanity advances, our ability to respond to mitigate these crises must evolve in tandem to protect public health and maintain the stability of our interconnected world. Thank you.